Hello everyone, this is Dr. Vaibhav Jain, agro-homeopath from Indore, Madhya Pradesh. So today I really wanted to congratulate Reed and publishers for reaching a milestone of 50 years of excellence in publishing. मुझे याद है when I was in college, my first few books from Reed and publishers, इन्होंने जिस तरह का कंटेंट, जिस तरह के ऑथर्स को होम्योपैथ तक पहुंचाया, दिस इज रियली एन इनक्रेडिबल जॉब। मैं टीचैन की पूरी टीम को अपनी ओर से, आशा होम्योपैथिक एकेडमी इंदौर की ओर से, एग्रो होम्योपैथी सॉल्यूशंस इंदौर की ओर से बहुत सारा कॉन्ग्रेचुलेशंस देना चाहूँगा, बहुत सारी बधाइयाँ देना चाहूँगा। आप इसी तरह होम्योपैथी वर्ल्ड में होम्योपैथी को स्प्रेड करते रहें, नॉलेज को स्प्रेड करते रहें और हम सभी को बेनिफिट करते रहें। थैंक यू एंड कॉन्ग्रेचुलेशंस वंस अगेन। कुडोज टू होल द टीम ऑफ रीड एंड पब्लिशर्स। When we talk about a single source where we can find different perspectives of homeopaths, where we can find the different reviews of new literature that is coming in our field and new research methodologies that have been going on, we always come to one name, and that is the Heritage Magazine. Today, I would like to congratulate them for completing 50 years in publication. For the last 5 decades, this has been the constant guiding system for many of the young homeopathic students, and I wish that for the future also, it remains the same. Thank you.
Hello everyone, this is Dr. Mansi from Homeopathy 360 and today we have Dr. Abdequaem Chimthanawala. So sir, a very warm welcome to you.
Yeah, thank you.
Thank you sir for joined us as our respected speaker on the platform of Homeopathy 360. And today we are very grateful to have you and and you are going to share a lot of knowledge with homeopathic students and physicians. So now it's time to a short introduction of Dr. Abdequaem. He is a successful practicing homeopath since 25 years at Abdequaem's Grace Healing Homeopathy. It marks a homeopathic clinic and pharmacy, Sita Buldi, Nagpur. He is also a visiting faculty for Materia Medica at Gondia Homeopathic College and Hospital. He has presented various presentations and published cured cases, research papers, and posters at national and international levels, and seminars conducted by Ayush, CCRH, HMAI, IIHP, and etc. He has conducted bi-monthly online sessions for international physicians and students. He has conducted clinical meetings for homeopathy physicians and classes for students under the banner of Grace Healing Homeopathy Academy. He loves to teach students, also an external examiner for Materia Medica and at Homeopathic College in Gondia and Chandrapur. He is also a life member of HMAI IIHP, associate member of GHF. He is also passionate about cure and research work in homeopathy, especially in coronary artery disease, hypercholesterolemia, chronic renal failure and kidney disorders, liver cirrhosis, liver disorders, diabetes and skin disease. He has various achievements also. He has cleared ZTWS training course and qualified as JC trainer in 2008. He has achieved various awards and trophies at national level. He has awarded the Maharashtra Ratna for his exemplary contribution in the field of homeopathy in 2022. Best Thesis Award entitled Scope of Homeopathy, Typo in hypercholesterolemia and coronary artery disease for PG Homeopathy London course in 2014 and whatnot. So, sir, we are very inspired by your work in this field and we are very grateful to have you today.
Yeah, so let us start and thank you for the brief introduction. And really great to know that Homeopathy 360 and Homeopathy Heritage is doing a wonderful job providing,
Thank you, sir.
platform for young homeopaths so that everybody can learn. It's a learning science, so everybody has to learn. And I'm very happy to see a lot of participants who have been with me for the past 2, 3 years in my YouTube and webinars. They're also there. Some international doctors also. So I welcome them all. And I hope I'm able to do justice to the topic psoriasis. So Dr. Mansi, how much time do I have?
Sir, you can take your time. We have chosen from 8:30 to 9:30, but it's not time bound. We
Yeah,
would love to gather knowledge from yours.
yeah. So normally exceed time because if there are question and answer session, it will take some long time. But let's see. I'll try to finish it. It's now 8:43, so we are at 15 minutes,
Yes, sir.
13 minutes late.
Sure.
So I'll share the PPT. Okay. First of all, let me tell psoriasis. When the word psoriasis comes in our mind, the main thing is that whether it is curable or not. What is psoriasis? What is the cause of psoriasis? And 25 years before my practice, when psoriasis patient used to come in the OPD, and he used to ask me, Doctor Sahab, kab theek honga? When it will get cured? Very difficult to answer at that time. But now, as I have understood the disease concept, the concept, how it enters the body and how does the miasm travel from psora to syphilis, it becomes easy for us to evaluate the patient and then prescribe according to the miasm. So first of all, briefly, I would just, because it's a seminar, so I'll just share my screen and make you understand what is psoriasis, because most of the answers, if you see, would be there in the PPT only, why it occurs and how does it occur. Let me share the PPT first. Yeah, so let us start psoriasis. So I am Dr. Abdequaem Chimthanawala. The only degree which I have is I'm a homeopath. Rest everything is okay, it follows. So first of all, let us see what is psoriasis. There were a lot of misconception and myths regarding psoriasis in the past. So we'll just first see what is psoriasis, what are the measures we have to take in treating cases of psoriasis. Moreover, I'll be talking about the clinical aspect, how to get the symptoms and what are the obstacles for cure. That is very important in psoriasis. So what is psoriasis? First of all, remember that it is a non-contagious autoimmune disease. This word is important because most of the patient comes and tells us, sir, I have psoriasis, whether my child will have it, whether my daughter would have it, whether my wife would have it, or my mummy would have it. So it is non-contagious. And as the name goes by, it is patchy abnormal skin, red, pink, or purple, dry and scaly. If you look at the pictures of psoriasis, which I'll show you further, it appears very dirty. And so we have a lot of remedies depending on the type of psoriasis. Psoriasis varies in severity from small localized patches to a complete body coverage. Now, this is important to know, no? Because sometimes, one spot is there and we say, okay, it may be a mosquito bite, it may be some eruption, it may be some allergy, but that is the starting point of psoriasis. So it is so important to diagnose psoriasis so that we can start immediately treating the patient as early as possible. Because in my experience, if you can diagnose it at an early stage, the cure is also very fast. Sometimes a lot of patient comes and tells the doctor, nothing was there. Only I was just cutting with a knife and there was injury on this part. And this spot has started from there. And believe me, that is the starting point of psoriasis. A simple injury can trigger a psoriatic skin spot, which is called basically as Koebner's phenomenon. Move forward. Now, of course, one thing is important that you must know the type of psoriasis. I'll tell you the importance of knowing the type of psoriasis also. There are 5 main types of psoriasis: plaque, guttate, inversive, pustular, and erythrodynamic. Now, if you see each type of psoriasis, it has a typical pattern. If you know the pattern, no, automatically you can understand which type of psoriasis is this. For instance, this is called as plaque psoriasis. Now, plaque psoriasis, also called as psoriasis vulgaris, 90% of the cases if you get in your OPD are basically plaque psoriasis. The typical presentation of psoriasis, red patches, white scales in the body. Most common affection is the back of forearms, the shin, the navel area, and the skull. Now see this type of psoriasis, it's appearing dirty, sometimes it is greenish, sometimes it is, scaly, and a lot of itching is there. It appears very bad and dirty. If you open the Mater Medica, if you open the Mater Medica and a Mater Medica, we have special. So we were just, I'll just recap this. So we started with psoriasis. This is psoriasis. Types of psoriasis. Yeah, I was telling you some plague psoriasis. Now this is because in our Mater Medica, what happens? We have typical symptoms. Like if you see Mater Medica of Arside, if you see Mater Medica of Etholium, we see Mater Medica of hydrocotyle, scaly eruptions, greenish eruptions, itching, reddish spot. Now, these are the common symptom of plague psoriasis. And as Dr. Haniman says, eliminate the common symptoms first and then first see the patient's personality. So this is very important to understand how does the plague psoriasis look like. In the same way, if you see gutted psoriasis, it has a drop shape pattern. So whenever there's a pattern and if you see it's a normal symptom, my suggestion would be don't take that symptom for prescription because the patient symptoms are more important than the particular symptoms. Now, this is pustular psoriasis. Now, whenever this type of psoriasis comes in my OPD, it appears. I basically make it a point to see that patient first because pustule is there. Though it is non-infectious, but it is filled with pus. Blisters are there. It appears very dirty, and when the patient sits in the OPD, and if the psoriasis is spread in the whole body, the patient automatically feels very, that dirty, that feeling is there. So this is a very dirty form of psoriasis with pus, blisters, like we have symptoms in mesorinum, the discharging pus and maggots are there, the scabs become very hard, this type of psoriasis. Inversa psoriasis, red patches in skin folds. And erythrodermic. Erythrodermic psoriasis occurs when the rash becomes widespread and can develop from any other part of the body. So this is generalized. And the most common, of course, you can see in ladies, especially I've seen fingernails and toenails are affected most people with psoriasis at some point of time. No, you can see in sometimes the nail there are pits, pits. This is also psoriasis. There's a change in the color also. This is a classical form of psoriasis that you must know. So in short, this is the types of psoriasis. Now, important is that how does psoriasis occur? Why it occurs, and what are the maintaining factors or what are the triggering factors that you have to look at the case. Now, why I'm telling this, because there are, in my practice, when I used to get this simillimum right, still, at a certain point of time, the medicine should stop working. And the patient said, Doctor, psoriasis is better 50%, but it is not going further. And then when I came and when I read the history of the psoriasis as in the book of medicine, there are a lot of trigger factors that you have to look into. Otherwise, your right medicine, you will change the remedy and the patient will again deteriorate. And you will keep changing it because you don't know the obstacles to cure. That's also given in the organ of medicines. So for knowing that, you have to know the trigger factors and what are the medicines or factors which basically have to be taken care of in curing psoriasis. Why I'm using the word curing psoriasis? Because in my practice, I have seen so many cases. If you have seen in my YouTube, psoriasis universalis from head to foot. We have cured that also. But these triggering factors, these factors which maintain psoriasis has to be taken care of. So let's go and see that. Of course, psoriasis is generally thought to be genetic. That is triggered by environmental factors. Now, as the word environmental factors come in, we have remedies for everything, aggravation winter, remedy, aggravation summer, remedy, aggravation spring, remedy, aggravation autumn, remedy. So this one word, will basically change the course of your remedy and prescription. This is very important, which environment. And if you see most of the cases, as you see here, are worse during winter. And remember that word which I have written, if you can see in my PPT, the remedies which can or maintain that psoriasis. What I've written, beta blockers, non-steroidal anti-inflammatory drugs, NSAIDs, infections, psychological stress. These all play an important role in weakening our immune system. Hello, are you with me? Beta blockers, such a common medicine, which a blood pressure patient takes. NSAIDs, we take these NSAIDs, over the counter. And we don't realize that if these remedies or these medicines are taken, they can hamper the effect of our medicine. They can change the course of treatment. In spite of a remedy being right, you will change it. Are you with me? Hello. Infection and psychological stress. Of course, now psychological stress, once this word comes, homeopathy stands apart. You have to know what is creating that stressful event in the patient's life. That has to be taken care of. Of course, medicine would work, but in these type of cases, making the patient understand what causes psoriasis, making the patient understand how to deal with it and will be able to treat him is very important. So counseling the patient is also important. Of course, it's not like treating a case of depression, but this psychological stress. What are the psychological stresses? That could be obtained. Your career stress, your money stress, your practice stress, children's stress, the education. There are a lot of stresses. So the patient has to be made aware that this can also hamper the treatment of psoriasis. Very, very important. Now, most of us know that psoriasis is associated with increased risk of psoriatic arthritis. Most of us know that psoriasis will go in the bones and cause arthritis. But you'll be surprised to know, there are certain diseases also which psoriasis is associated with increased risk of. And that can be cardiovascular disease. As Dr. Mansi was first telling, I am more interested in treating CADs. So if a psoriasis patient is suffering from CAD, I have to look at the miasm, how it is traveled. Crohn's disease, depression. Psoriasis is associated with depression. Okay. Why we say psoriatic arthritis? Because, 30% of cases of psoriasis land up in psoriatic arthritis. But in this slide, the most important is Crohn's disease. As it is labeled, Crohn's disease is incurable, but in a psoriasis patient, very, very important because they can get it more than a normal individuals. So this slide becomes a very important slide. As Haniman Doctor writes in the Organ of Medicine, obstacles to cure. I'll basically describe that in detail also, but just a slideshow to make you understand where are we heading for, what are the important things to be taken care of during treatment of psoriasis. It is not that take a case, similimum, give the remedy and the patient start getting better. You have to understand the patient. You have to see the whole sequence of patient, how the patient is going through. Okay. As we move forward, there are 10% of cases of psoriasis which are rare, pustular, inversa, napkin psoriasis, oral and seborrheic-like forms. Of course, we have covered some of the causes, lifestyle. Now, this is also important, the last part. Cigarette smoking, obesity, and alcohol consumption. In this psychotic world, psychosyphilitic world, most of our patients, if you see, have been taking alcohol, and for them it is very normal. Everybody takes it, so we also take it. Cigarette smoking. This is a very bad, important thing because, for example, if I don't smoke a cigarette and if I'm going somewhere and others are smoking, I become a passive smoker. And if that patient is suffering from psoriasis, he says, sir, I never smoke a cigarette. I never eat pan, tobacco, supari, but still how my psoriasis is not getting cured? Because he's a passive smoker. Hello, are you with me? Yeah. So let us go forward. And climatic changes, stress, I have already told. One thing which is very important, includes chronic infections. I had a case where the patient, came to me. I will discuss that case if we have time. The patient said that my daughter is suffering from recurrent cough and cold for the past 3-4 years. But that is cured, doctor. The doctor gave a fantastic medicine. But now since 1 year, she is suffering from this psoriasis. Why do we need to answer that? Because once the psoriasis starts getting cured, we expect the chronic infection, the recurrent cough, cold, coryza would also come because it is Hering's law of cure. You'll be surprised, we have been reading that, rheumatic heart disease is because of streptococcal throat infection, that infection from the throat goes to the heart and cause rheumatic heart disease. In my future slide, I'll tell you that could be also a triggering factor in psoriasis. And of course, dry skin dryness, that's also a very important part. So these are all the basic causes. Lifestyle, there are a lot of lifestyle things which have to be taken care of, which I'll tell you in what are the obstacles to cure. Okay. So is this okay? I hope the speed is okay because somebody is messaging me on the WhatsApp. I hope the speed is okay, Dr. Mansi. Are you with me with the pace?
Yes, sir. This
Yeah.
video is really fine.
Yeah, okay. So let us go forward because there is something on the chat which I'm not able to read because I'm just first completing the slides. Okay. So let us go forward. Now you have to, these slides basically show that when the immunity goes weak, we have basically patients, we can have psoriasis type symptoms in the body. One disease that you have to know where the immunity is the weakest. And what is that? That is HIV, immunodeficiency virus. Now, I have so few cases where the rate of psoriasis in HIV positive individuals is comparable with the non-HIV tends to be higher because of the severe infection of the HIV infection. This is very important to know because, see, as such, there is no treatment or no cure for HIV, but there are a lot of cases of HIV under my treatment who have psoriasis. The potency and the repetition varies in those individuals. That you have to know. Otherwise, it's every time the treatment is not like give that dose and just wait and watch. It is important to see the follow-up. What is the patient taking? How is the environment? And what is the immunodeficiency disease the patient is suffering from? I was just telling, the slide, the streptococcal infection which causes rheumatic heart disease. So the next cause could be microbes. Very, very surprising, when I was reading psoriasis years back, I was surprised that this can also have a effect on the treatment. See this slide. Psoriasis has been described as occurring after streptococcal sore throat and may be worsened by skin or gut colonization with Staphylococcus aureus Candida albicans. Such an important thing we miss out sometimes. Gutted psoriasis often affects children and adolescents and can be triggered by recent group A streptococcal infection, tonsillitis, or pharyngitis. Now, this is the beauty of homeopathy. Are you getting me? What is tonsillitis, pharyngitis, itis, SORA? Now, see how the diseases travel from SORA to syphilis. So, when the patient does not tell you also anything, doctor, I had this tonsillitis that is gone, but I've got now this skin patch. So, see the travel of disease so fast, direct from SORA to syphilis. So, a remedy also has to be like this. The speed of remedy then has to be fast. Are you with me? Understand this. Simple, separation of SORA. That's why we tell all the patients coming to us, don't give antibiotics, don't suppress it, because what the body will react depends on person to person. That we can't tell. So the speed, see the speed, tonsillitis, pharyngitis. I have written recent, triggered by recent, matlab abhi. It has occurred in 1 or 2 months, psoriasis starts. See the speed of disease from SORA to syphilis. So the remedy also, we have speed of the remedy, slow acting remedy, fast acting remedy. So immediately that should strike in your mind. Okay. I have told you some medicines, like beta blockers. I've told you, non-steroidal anti-inflammatory remedies. One thing I just want to tell you, one thing yeah, anti-malarials. So many, we have in India malarial belts where they give anti-malaria treatment just for fever, and the patient says, I've taken malaria treatment for 3 times, 4 times, but they have come to us for psoriasis. One more thing, if you see calcium channel blockers, lipid lowering medicines, make sure that if the patient is suffering from, or if the patient is taking those medicines, make sure that that can also occur, drug-induced psoriasis. Very, very important to know. That's why a homeopath has a lot of work to do. Case taking, analysis, what he's taking. That's why, you have to have some knowledge of the allied medicines also. What are the what are the side effects, drug induced. This is very important to know. So our knowledge is not only limited to our therapeutics and our mathematics, but it has a very wide range of application. You have to read this pharmacology also if you want to be a better practitioner. You must know which medicine to give where. There are other medicines also. I've only given those medicines which I have seen in my practice a lot of times. Lithium. Lithium, in case what lithium is given in most of the condition of psychosis, bipolar disorders, schizophrenia, and allopathy medicines. Now, what is written? Drug-induced psoriasis. Lithium. See, so unnecessary. The patient is going for treatment for this disease, and sometimes you get other disease, and he comes to us. and then we have to evaluate and then prescribe the medicines. Okay. As we go further, I have told cardiovascular disease, Crohn's disease, they are more susceptible. Psoriatic patients are more susceptible. Of course, psoriatic arthritis, I told you 30% of cases taken out. The last 70%. Now, psoriasis, a patient suffering from psoriasis is more has high risk of suffering from myocardial infarction, depression, diabetes. You can see the percentage, of course, yeah. Comorbidities. It is 2.2 times increased risk of CVS in people of psoriasis. Also, people of psoriasis are more susceptible to myocardial infarction and stroke. Remember this and see this percentage, all doctors, my friends. Depression or depressive symptoms are present in 28 to 55% of people with psoriasis. Very, very important. And that's why we say homeopathy, we are blessed with such a beautiful science, holistic approach. We have everything so, methodical and mathematical that we have to just pinpoint why is the patient suffering from psoriasis, comorbidities, and of course, the killer disease which is coming, that is type 2 diabetes. See, people with psoriasis are increased risk of developing type 2 diabetes. Such an important thing which we have to understand. If you don't understand, you will only limit the patient 60%, 70% better, but same medicine, repetition, nothing will happen. That is very important. So this is in short, because we are running out of time. I cannot have so much time with the just basic part of psoriasis. But now, if in modern science, one slide, one word which I did not tell you, withdrawal of corticosteroids also could basically give rise to psoriasis. Now, why did I tell you? Because the management of psoriasis in other school of medicine is very, very simple, very, very easy, First of all, the patient understands that he is not going to get cured. The doctor has told him, and he has told that put up topical steroids, take these vitamins, and that's you have to live for life. Keep your stress away because you can't do anything for the stress, they say. So management also is very, very important. I had a very interesting case when the patient had psoriasis and he was advised removal of tonsils. I thought, what the doctor has told you, how can you remove tonsils for psoriasis? But when I was reading psoriasis, it was written that there are some evidence, very limited evidence, that removal of tonsillitis may benefit the patient suffering from either plaque psoriasis, gutted psoriasis, or pustular psoriasis. So this is also important that, the treatment part of the modern science, and then we can, of course, look at our treatment and then go forward. So if you see a management for topical corticosteroids, whenever we are having a gathering with 11 doctors and also, they say our treatment is very easy, we have to study very hard, for years, and then the life becomes very easy because we have steroids, we have antibiotics, and that's all. First generation, second, third generation, and people also understand that allopathy is temporary, so they are absolutely happy. They know that there is no cure. The problem is with homeopaths, because there's a one word for every homeopathy doctor, कि हमारे दवाई बीमारी को जड़ से निकालती है. We treat from the root cause, and then the problem starts. All patients who come to us, they know that homeopathy can cure, and every time they ask, sir, when it will get cured, how much time it will take. And everybody, goes through this part in his life, because we can't say, now we have given the medicine and it will cure in 2 months, 3 months, 4 months, 6 months. Very difficult. But as you mature in your practice, you have seen so many patients, you can always tell them, if an allopath can't cure, how do you expect? Give us some time. That is very, very important, my dear friends. We have to be confident. And I hope this, a small 1 hour lecture on psoriasis helps you in treating psoriasis, because this part of management very, very important. Of course, in today's world, one vitamin which is very, very famous, everybody gives that vitamin because they feel that vitamin basically would cure everything. And that is which vitamin? Anybody? Vitamin D. Vitamin D can, treat depression. Vitamin D can treat heart disease. Vitamin D can treat just everything. So this is also vitamin D. Give vitamin D and the patient starts feeling better. You can have, see, a lot of variations of vitamin D, calcitrol and calciprol, or lot of things here. You can see this. This is one of the vitamin D is also one of the treatment. Now, the other treatment also, which is very, very important in modern science, is moisturizers and emollients. They give a lot of oil and petroleum jelly, uh, and they keep applying that, and they feel that it is better. Now, you must have also seen the practice, patients. I had a patient, when he had so much psoriasis since so many years, he used to come in my OPD, first go in the bathroom, put water everywhere the psoriasis was, apply an aloe vera cream, and then used to come in my OPD and sit. And I used to see him first because, you know, pustules and superadded infection, pus coming out, dryness, itching, flaking everywhere. He also was tired. The patients were looking. He used to apply so much, that petroleum jelly and this oils and all, nothing worked. But by the grace, as we say, homeopathy helped him very much. He's much, much better, and he's through with the treatment. But I was just trying to tell you so many, topical applications people use. If you ask me, sometimes a patient tell doctor, "Sahab, tell us something, your clinic is so far, we stay away from Nagpur and the skin becomes dry, you tell, don't apply anything." Sometimes I tell the patient, just put just plain Vaseline so that there's no burning and it has a soothing effect. But apart from this, please don't tell them to apply steroids, because you know what happens? Once you put a steroid, automatically that part, automatically medicine's action is not so as you expect. And when you withdraw that steroid, it again increases. So it is very important how and what you tell to your patients. Next treatment is UV phototherapy. This is also very common for either psoriasis or vitiligo, sunlight. It has been used for ages. The sunlight may cure. I've never seen, And lastly, which I just told you, removal of tonsils, which, I was also very surprised that this is also part of sometimes there is of course limited evidence, but they say, but because you have got tonsillitis and immediately you got psoriasis, so remove the foci, so that automatically the psoriasis start getting better. But it's all permutation combinations. I was just telling you about some disease, the disease which are very common in psoriasis, because of late, we had never seen 10 years back gluten allergy and milk allergy and nuts allergy and so much allergy. But now, people come, "Sir, I'm gluten allergy, I don't have gluten. I'm this allergy, I don't have this." So you have to understand in relation to psoriasis, the rate of Crohn's disease and ulcerative colitis are increased when compared with the general population by a factor of 3.8 and 7.5 respectively. People with psoriasis also have a high risk of celiac disease. So there was a hypothesis, in modern science, that everything, you must have seen Insta reels and YouTube reels today. A lot of reels have that everything starts from the gut. If you want to treat psoriasis also, make your gut healthy. If your gut is healthy, automatically psoriasis becomes better. And the evidence to prove that is, I have told you in a lot of slides, Crohn's disease and ulcerative colitis, celiac disease, irritable bowel disease. There are so many diseases related to the gut. And that's why you must have seen in the modern medicines now that people say that if you want to cure psoriasis, it starts from the gut. Everything starts from the gut. Make your gut healthy and automatically psoriasis goes. Of course, this is what they feel. Do we feel this? No. We believe so much slides. I've just run through the slides so that I can complete and then give a broader idea. We believe that everything starts from the mind. It's of course only one part of the common phenomena which I told you. Because of injury, the psoriasis starts. You can take that also. What Dr. Haniman said, that is very, very important. And these, obstacles to cure. Now, this is very, very important to know. This, if you know, you will be able to treat more cases of psoriasis than you have been treating it now. First, as we have gone, let me tell you first, smoking and alcohol consumption. Obstacle to cure. I've written this purposely because a lot of people just tell me one thing, "Doctor Sahab, I only take 30. That is nothing. How can that cause psoriasis? My friend takes every day, 90 or I don't drink, so I can't tell what is 30 and what is 90. But whatever the patient, tell us. Local applications, very, very bad. If you treat the local part, psoriasis can never get cured. Make sure. If the patient stays far, as I told you, I tell him to apply some petroleum jelly, no medicated creams, nothing. Cosmetics. If you have some uh, patients, VVIP from film stars and all, they tell me one thing, sir, I can leave you, but I can't leave cosmetics. And if you see cosmetics, if you see the content of cosmetics, you'll be able to see they are so harmful, and that can cause a lot of problems with the psoriatic patients. What is the meaning of radiation and EMFs? In today's world, believe me, in today's world, if you are not taking care of radiations and EMFs means electromagnetic frequencies, the Wi-Fi. If you have towers, I had some cases where the patient had, he was a big businessman. He had a big land and lot of business outlets, and also he had put that tower, the Wi-Fi tower, and his psoriasis was not getting cured. He was much better, but suddenly it was increased. After a lot of research, I found that there was a lot of Wi-Fi radiation. He was using a lot of mobile. A lot of government officers come to me every time on mobile. This is very, very important in today's practice. And we have medicines. Mobile radiation, we have a medicine, mobile radiation. I think 1800 hertz, lot of medicines are there. Wi-Fi also, we have medicines. Make use of this medicine in your practice. As we say, if there's a block, give this medicine, intercurrent treatment, it will clear up the block. I have seen, do also use in your practice, because if you are not covering this radiations in EMF, maybe you are not able to cure few percentage of the psoriasis cases which are caused because of that. And of course, vaccination. I'll not name the vaccine, but everybody understands, Post this vaccination, we had that flare of COVID-19, so many cases of psoriasis, we had cured 90% suddenly came up. And just wanted to add one medicine which is not written here, COVID-19 medicine. If you give that COVID-19 in potency, 30 potency, 200 potency, which I have, wonderfully it works. And if you see the slide before slide, I have written there also, tonsillitis and streptococcal, recent streptococcal infection and COVID. So we have remedies, streptokinase, oxalicoccus. So pinpoint in the history taking is very, very important in homeopathy. Hello, are you with me? And I'm just talking to the computer. I hope you're understanding it. Okay. If I'm fast, please tell me. Daily habits, stress for the mind and body. This, everybody goes through these stages, and when we take the case, we'll see how does it affect the body. Diet and nutrition. If you must have seen the latest, logistics, there was a business of 35,000 crores of this online business, Swiggy, Zomato, I don't know, Blinkit, and what, 35,000 crores. There was a beautiful, video also of one of the chefs in India that please eat at home. So, see, if you're procuring something from outside, definitely it differs from what is cooked inside at the house, So this has also been such an important factor, and in my practice, I have seen, I always tell the patient, eat more of salads, fruits, sleep, and water. These four things are very, very important even in psoriasis, but in normal sense also, increasing the immunity, fighting the infections, antioxidants are very, very important. Remember these four lines: salads, fruits, sleep, and water. So diet and nutrition is very, very important in obstacles to cure, which Dr. Hahnemann has said in the aphorism, Organ of Medicine. It's 9:20. I'll just complete this and go for the case. Yeah, now some takeaway points. I'll just sum up this and just we'll have some takeaway points. If you have understood this about psoriasis, how it happens and what are the disease to be taken care of, whatever disease to be looked at, which medicine might hamper or cause drug psoriasis, Few takeaway points which are very, very important because this is a very important slide. It's a holistic treatment which is required. And when the word holistic comes, mind, body, and spirit, one pathy shines, and you should be lucky that we are homeopaths, proud homeopaths. Of course, whenever I tell this to the, when I'm teaching mathematics, the students just are how proud, so difficult, to take the case and analyze. I always tell them, I have also come from that stage. I have also had a lot of failures. So much failures you have never tried. Also, I have failed in so many cases. But keep reading, keep doing webinars. So much material is available. Homeopathy 360. Every day there is some webinars. Attend, follow something, and you will definitely gain with this. So holistic treatment is very important. Second, which medicine the patient is taking is important to know for the treatment and prognosis of the disease, which I have categorically told you very well. Very, very important, my dear friends. Third, as I told you, stress and depression can be the major cause of psoriasis. Hence, homeopathy will play an important role in treating psoriasis. In fact, if I want to change one word, I would write, hence, homeopathy only will play an important role in treating psoriasis because only homeopathy works through mind, body, and spirit. There are a lot of, elements there are a lot of causes which I have seen in my practice. But for that, it would require another 2 or 3 years. So I have just make that takeaway point so that in general I can give you in psoriasis. Our approach should be finding simillimum according to miasm, very, very important miasm, and to avoid the triggering factors in the process of our treatment. My dear friends, miasm, the backbone or is for homeopathy. As I told you, from streptococcus to psoriasis, the speed, the patient will not tell you that I'm a fast personality. You have to judge. Observation in homeopathy is very, very important. How does the patient enter your clinic? First, how does the patient occur? How is the patient telling you the symptoms, and how you are interpreting that observation into a rubric form or the mater medica form. And lastly, is psoriasis curable? Let us find out with a case. Of course, if I don't show a case, that means it's only a good lecture and no clinical. But if I'm not able to show a few cases, you can always go to my YouTube channel and see. I've put some cases of psoriasis. You can see. So up till now, I've tried to give a summarized view about psoriasis. I hope you are understanding this. Should we go forward or should we take some questions on this? Yeah, Dr. Mansi.
Yes, sir. We can continue with the
Okay.
case.
Everybody is understanding. I hope you are understanding the speed, the language. Okay, so let us go forward. Uh, we'll
Excuse
not
me,
take the
sir. So,
yeah.
few attendees have said they are not able to see the PPT. So, I would like they have said it earlier. So, I would like to confirm again. So, everyone, can you answer this? That is PPT is visible to you? Yes, sir.
Yeah.
Now they are saying that it is visible. Okay, thank you so much.
So let us go forward. So I'll not take the first remedies. Let me take the first case only. Yeah. So I'll first show the video of a case and then let's go forward with the whole case thing. Okay. So I'll just stop here and share the video of the arms. Let's just see the psoriasis. It is whole body psoriasis. The patient had psoriasis for 4 years and done all the treatments everywhere in the body. Just see the video first, then I'll give the case. So this was the case, the shooting. So let us see the whole case first. Yes, now. Yeah. Slideshow. So case history, it is abridged to include main points only. So girl, 16 years, came for treatment with a mother who said that it was a small boil 5 to 6 years back. We applied ointment, it was much better. After a few days it reoccurred, we applied same ointment, again it got better. As years passed by, it increased and now it is all over the body. Now, if you have seen my OPD, it had psoriasis from head to foot everywhere in the body, everywhere. Not a single part of the skin was without it. So tried more treatments at our place, like Jabalpur is a place in MP. They have done homeopathy, everything, but it did not cure, was not cured. Earlier, patient covered her skin and no one knew about it. Now it's visible as it is all over the body. Now this is the mother's side because I have the shooting of the mother also, but she speaks for at least for half an hour, so we can't do it at verbatim. That's why I've abridged it. The patient's mother came in the first and informed us to tell us to give her assurance that this will get cured. First, the mother came one day before to take an appointment and just to tell us that please, when the patient comes to you, just tell her it can be cured because no one is giving us this confidence. At school, she is very studious, and when she does not perform well in even in one subject, she gets very upset and her mood is off for many days. Now she will come inside, so please give her assurance. We tried visiting doctors and getting no result. Present complaint. Now in psoriasis, see if it is of 5 to 6 years of duration, the complaints are most of in a lot of cases the same, itching, itching, and itching. The child entered and we asked her about the complaints, and she said that her mother must have already told you. It is like itching, flaking, and irritates the skin. Mummy takes me to so many doctors, but they all give me medicines and not better if stopped applying ointments. Her mother interrupted that her score in science is good and she wants to become a doctor, but her skin has not improved in spite of following the instructions of doctors. She feels it's no use to become one if they can't cure. So, see, medical science, the whole career of the patient is at stake because she feels nothing is going to happen. At school, she was good in class and students listened to her, good in speaking at class, represented for elocution and Hindi poem recitation. Elocution means speaking in front of public, and Hindi poem recitation. He was good in Hindi also. But now, due to skin problems, she has no desire to participate in anything. She does not like to go out without anybody. She keeps complaining that in spite of being a good student and friend in school, no one helps her when she wants notes or any help during exams. As a CR means the class representative, the teacher gave her a lot of assignments to complete. Solve the queries of students by staying back over time in school and at the cost of her studies. But today, no one is bothered whether she needs help or she does not need help. They keep looking at her skin and want to maintain a distance from her as though she would infect them. Such behavior makes her very sad and she ends up crying. At school, she feels that no, now the marks and her position is going down day by day and will not return because the disease is spreading. Then we asked, how is the itching? Don't ask the itching. The patient is so tired telling it is itching, 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 and then we say it is better by hot or better by cold or better by warmth. The patient has applied so many local applications, corticosteroids. The symptoms, sometimes you don't get because they are the symptoms of suppression of steroids. So when you're taking these type of symptoms, be very sure that you're taking the disease symptom, the patient symptom, or the symptom because of the use of other school of medicine. Very, very important in treating psoriasis. I'm also feeling like I'm going down. When these thoughts, when the patient tells you in front of, it's the gravity of what the patient tells you is very, very important. When the patient said this word, Doctor, sir, I am going down in my life. The expression of the patient was like this. When these thoughts keep nagging her, the itching aggravates. In general, there's a lot of itching. We have applied so many creams, don't remember when and how it itches because every cream affects in its own way. Now she has stopped understanding when does it itch. It itches, she applies the cream. I want to scratch all the time, and seeing my father, he gets very irritated. The father should not get angry. That's why she applies the to control the itching. Itching is more when she's in the bedroom or when she's in the kitchen. Sometimes there is a sticky discharge. Now comes homeopathy, that's how we always mind. Mother said that she is getting angry at silly things. And silly things make her very upset at school and at home. Sometimes she speaks abusive language. She speaks out at all of us except the father. If we want her to do anything, we tell her father because she listens to him everything. She, since she was a young girl, she listened only to her father. She studied hard because her father took up her studies and wanted her to be top in the class. As most of the father, want the daughters to be at the top of the class. So I'm sitting here, so she's speaking so much. But if her father was around, he would keep silent and only be would have spoken. Hobbies. This is also very, hobbies are important because they're innate characters. You don't think and start the hobby. Hobby is innate. It comes naturally to you, like that. She's fond of good food, not fussy about anything specific, but she has to be served hot food. Cold food makes her very upset and she won't eat it. Onion raita, क्या बोलते हैं उसको? Salad. किसका कांदा बोलते हैं उसको? प्याज का सैलेड इज अ फेवरेट बट शी कीप्स रिमूविंग टमाटोस. हम रायते में डालते हैं ना, प्याज डालते हैं, टमाटो डालते हैं, ककड़ी डालते हैं. इन दाल तड़का शी ओनली वांट्स जीरा बिकॉज द गार्लिक मेक्स her स्टमक अपसेट. वो तो गार्लिक बहुत हार्ड पड़ता है मेरे स्टमक में. शी प्लेस कैरम बट इज अ बैड लूजर. हारना पसंद नहीं उसको. आई होप everybody understands Hindi. Okay, a few I think of the international doctors would not. She cries when she comes home after losing. She plays opposite the children's only in the building. I'm telling Hindi because I can remember the case in front of me. मुझे डॉक्टर साहब हारना पसंद नहीं है. The wordings of the patient, such a, that's why it automatically comes. Now we asked about the past illness. Okay, her granny had taught her knitting and she was very good and she used to do it very neatly. Knitting is like it's we knit sweaters and all that type of knitting. Past illnesses, recurrent cough and cold, fever, tonsillitis in childhood, taken allopathy medicines. See, when we started with this and we're ending with this only. Very, very important to know where is the SORA gone wrong. For the past 3-4 years, no problem with the above complaints. We were very happy that the doctor has cured her cough and cold, but suddenly the skin symptoms started coming. She's fully vaccinated, no problem post-vaccination. She suffers from diarrhea due to outside food and overeating, which was better with conventional treatment. Then we ask the thermals. She drinks water whenever thirsty. This is a very common answer. Hindi में जब प्यास लगती पानी पीती हूँ. Whenever I am thirsty, I drink water. And you keep probing how much glass, how much. I don't remember that. So if the patient is not trying to tell you, how much glass, forget it. Don't just make symptom hot and thirsty. If you're not getting it, forget it. Okay, we have a lot of other symptoms to give the medicine. Bathes with regular tap water and she can bear more cold weather. In the heat, the skin feels very sticky. Again, she interrupted saying that, will this be cured? Otherwise, after asking so many questions and applying creams, there will be no result. Very, very important. Just one note I'll tell you. If you get the thermals very, very particular, very, very in syphilitic case, take it. Otherwise, leave it. It's only a syphilitic, out and out syphilitic case with a lot of ointments, medicines, steroids. It basically will change the thermals and thermal axis. So if you get it very right, take it. Otherwise, it's no problem. We have a lot of other symptoms to get the medicine. Then we asked about the sleep. Sleep was like, she does not like to cover and sleep only on one side. Her mother said that usually when she had a bad day at school, now remember the wordings, or after losing a match, or if she has fought with anybody, she does not sleep peacefully. She gets dreams, but she does not remember. So in short, I have just got the case, I've just told you the case. If I ask you now, analysis, how do you look at this patient? If you have understood little bit of what I have told you before in my in the lecture, how does it occur and what are the causes and how, can you analyze the case? Anybody? If otherwise, we can go forward and finish off the case. Now, one thing which I would always like to tell, which I'll always tell to my students, if you have selected the rubric right according to miasm, mark my words, miasm, then the remedy is right. And if your remedy is right, all the symptoms will fall in that remedy. So whenever I am repertorizing a case, I repertorize with just 2 or 3 rubrics given to the miasm. Then I might tell my assistant doctors, I have given the drug, you now repertorize the whole case. And sometimes they're surprised, this is also the same remedy and this is also the same remedy. But I repertorize maybe 2 or 3 rubrics, they repertorize with 5, 6 rubrics or 8 rubrics, the remedy is same. Of course, if it's a rare remedy, then it's a different thing. But this is the beauty of homeopathy. Just understand the miasm first because it's a syphilitic case, then you can get the remedy right and the patient right. Okay. So any rubrics, first of all, my suggestion to all of you, don't jump to rubrics. Don't jump, you will get it. First, analyze the case, summarize the case according to you. The symptom will automatically fit. The rubric will automatically fit. In this whole case, which I found very useful, I found very useful, Yes, anybody? I have in fact, a lot of doctors have written. I'm not seeing that because if we'll do the question answer later or we'll do it now.
So we can have the question answer in the end of the case.
Yeah. So we have beautiful rubrics, desires, light, and very well, very well. So we'll do it first. So for me, the case was only one thing, and that was the entry point of the case which I took. If you were very, witty and if you're very observatory in what I have written in the case taking, there were certain, lines which I had written in italics. That was the entry points of the cases. If all the doctors would have seen some slides by this is the slide I've made by my missus, so I told her to do that because italics me, and those were the points of entry. For the first time, when I saw this case, I found that the father was very dominating. Every time the patient told, when my father comes, I apply cream so that he should feel that nothing is happening. When my father comes in the OPD, I'll not tell him the symptoms. I cannot, my father. I took the entry point that. And the mother told, syphilitic part. The patient says, I have helped so many students in my school days, giving them notes, giving them essays, everything. But when my time has come, nobody wants me to help. And third was, she becomes angry and now I'll not get cured. Every time the patient told me, will it get cured? Please tell me. Please tell me. The mother had to come one day early and tell me, please give a reassurance. These were the only entry points I took for prescription. The remedy was very simple. The case was very simple. And I prescribed simple remedy. I think everybody must have got the answer. Yeah. So in homeopathy, when the rubrics are right, automatically the remedy comes very fast. So I gave her lycopodium. Now, I started with lycopodium 200. Of course, the rubrics you can see, weeping, ungratefulness, discouraging children, and dominance of father. Lycopodium 200 single dose, and see the follow-up. See the beauty of homeopathy. How does the patient come and tell you? Patient's mother came and told me one thing. She said for the first time, she did not listen to the father and went outside to have some food with her friends. My dear doctors, this is what we in homeopathy we want. The patient does not come and tell, okay, my psoriasis is cured with the first dose of medicine. The patient comes, the generals comes first. For the first time, she did not listen to the father and went out to have food with her friends. The father was surprised, the mother was surprised, even the patient was surprised. And the patient told, now I've become very, courageous. She has become courageous because our lycopodium has worked. And I was sure that the medicine is right because we have taken the entry point that only elements from dominance. Hello, are you with me? Are you understanding, my dear doctors?
Yes, sir.
Yeah, patient said the doctor has worked on the case. I am feeling better. This is the wordings of the patient, you know. This is what the patient comes and tells you. Doctor has taken so 2 hours of case taken because he has done so much, मेहनत किया है हमारे पे इसलिए हम दवाई काम कर रहे हैं. These are the wordings of the patient. After 2 months, because she does not live in Nagpur, she came. Patient was happy to reveal that the performance in the school has improved. See, up till now, 3 months have passed. The patient has not told anything about this psoriasis. She's happy eating outside food. She's happy that she could tell her father, and she's happy that her performance in school has been good. And now she appears happier than before. This is what is the beauty of homeopathy. The mind comes first. We noticed that the patient was more relaxed and was not interrupting with her mother when speaking. You know, in my case, taking the patient said, will it be cured? We have taken so many treatment. The thing is working. The thing is working. Now she is not interrupting the mother. Patient suffered from cough, which she had before. She had only hot water to soothe it. It lasted for 3-4 days. Now it is better, but she did not get fever. That was a positive sign. This is so important, my dear doctors, to understand the follow-ups. The follow-ups are very, very important. If you miss out on the follow-ups, you change the medicine, you will mess up with the case. You'll mess up with the case. After 4 months she came, the girl asked me why she did not get results from previous treatment. Why I did not get results from the previous treatment. Okay, so we can't answer that. She was happy that the skin eruptions were better and the relationship with the father had improved. She does not feel undue pressure from him. At school, now she had become cheerful and more social. And the patient had a follow-up for 2 years, not even a single eruption. Treatment has been stopped. I think she is now 19 and she still remembers me because whenever she gets cough and cold, you know, I think it's not working. The battery. She remembers me and we gave her placebo and she knows if to take Phytum and she's much, much better. This is the beauty of homeopathy, you know. This is the beauty which I wanted to share. This type, of course, I'll show you the follow-up also. She's absolutely cured. Now, before we study Lycopodium from Clark, I'll go forward with that. I don't want to discuss the mathematics. We have no time. I just want to show something. Yeah. Now, as I told you, forget this slide. You forget this slide. As I told you, if the remedy is right in Sora, in psychosis, in syphilis also, the remedy will work. Remedy will come in your repertory chart. Anybody, I think a lot of doctors have answered. Sorry, I could not see your answering, you know. But if you have seen my case taking at that time, you know, I had written something in italics. And you'll be surprised, you know, when she takes out tomato from the raita. That is also lycopodium. See the chart of lycopodium now with so many rubrics, my dear friends. Just see the chart of lycopodium now. Yes, you answered right, doctor. Abusive. Abusive, lycopodium. Sudden anger, lycopodium. Answers, dictatorial, lycopodium. Delusion, sinking he is. What did she say? Doctor, I know my performance is going down. Day by day, I am going down in my life. Nothing is happening. Itching, overheated when? How? But I told you, when she's in the bedroom or in the kitchen, the itching is more. See, lycopodium. Discharge from the psoriasis was sticky. Food, drinks, tomato aversion too. She's taking out tomato from the raita. Desires hot food. She told no, I want everything hot. Cold does not agree. And sleeplessness after anger. Are you with me, doctors? Are you with me? This is the beauty of Mater Medica. You know, from any point you enter, it is lycopodium. This is your Mater Medica, your understanding of converting the patient's language into Mater Medica or rubric form will guide you to the remedy. This is so much. See, a lot of doctors have written abuse and all. Everything which I've written in italics is matching with this. That is the beauty of homeopathy. I hope you got it. I'll just show you the cure because otherwise, you know, it will be nothing if I don't show you the cure. So, Dr. Mansi, I'll just show the cure first and then we'll go forward. Any questions up till now? Of course, the patient is cured. That's why I'm presenting this case, otherwise I'm not presented the case also. And so after treatment, there is. So, no, her brother came to me and said, sir, we have a car, it is scratchless, and my sister's skin is now scratchless. It is no eruptions on the body, absolutely perfect, as if she was born now. The wordings of a brother. Now I have not buffered this, so I don't want you to see this. So I'll just go forward. I hope you understand that. Net was the problem. So this is after the treatment. As you can see, the every part of the body. I'll just show you. Yeah. So this is the follow-up of the case, and she's absolutely better. There's no sort of part of psoriasis left in it. Before we end the follow-up of the patient, she came for at least for 2 years, and still now she's absolutely fine. No problem with the eruptions and anything. Yeah. So this was lycopodium, which I wanted to share. I did not take the rubric for prescription, but if you have seen the italics of my case taking, every answers dictatorial means whenever she used to answer, I've not short the make you say the whole case, but she was telling that was an observatory symptom. Every time she used to come and say whether it will get cured, and the wordings and the voice changes. This is actually, if you have seen, if I have lycopodium, I will tell you what actually why is lycopodium dictatorial. This is very, very important to know. If I have that slide, I'll just see the slide. No, we don't have. So, see what happens in lycopodium. There are some reasons why a lycopodium patient becomes dictatorial. Uh, you know, because she has suffered from the dictatorship of the father, and the same she reflects in her behavior and that. That's how a lycopodium transfers from one to other. She has become dictatorial. She has become very dominating. She does not like to lose. She's a very bad loser. She's very abusive. This is lycopodium. This is actually lycopodium. We can see in patients in generation how it develops. If you see Clark Mathematics also, he has written beautifully about lycopodium. So this is the Mathematica. But sometimes, in acute practice, I'll just share one or two remedies where you must know these remedies. Sometimes what happens, you are giving a constitutional remedy and acute flare up comes. There is a lot of dryness, there's a lot of itching, there is a lot of uh, psoriatic patch coming off. So there are few remedies which you must know where you have to use this in water dose so that it does not affect the action of medicines. That is also very, very important. In that first, you have to remember one medicine which I have, seen in my practice works very well. That's a no sort of back, Salmonella, enteritis, no sorts of back. A very important remedy for plantar psoriasis. Chapped hands in winters, the patient chews the nails. Very, very important in where the psoriasis is related to palms. So if you have cases where you have given calcarea floor, you have given sarsaparilla, you have given petroleum, never worked, this nosode will work wonderfully. One remedy, if I don't tell you, it will be it will be half done psoriasis. Everybody, in our practice have seen arsenic iode. Typical presentation of a plaque psoriasis, if you know the picture of plaque psoriasis, dryness, itching, and scaling. Dryness, itching, scaling, exfoliation in large scales. And there is raw exudate beneath the surface of the skin. This is a classical presentation of psoriasis in arsenic iode, but make sure that it is not a routine prescription in you. If it's a disease symptom, don't give RS iode. We have seen, I've also given RS iode maybe 10, 15 years back, but now make sure that you are able to differentiate RS iode with a normal symptom of psoriasis. Corallium rubrum, never heard of the remedy apart from cough. But if you have seen the slide before, red flat ulcers, coral colored, they are dark red spots changing to copper colored spots, a very important remedy for psoriasis, especially again for the palms and the sole. Corallium rubrum. Now you will see this presentation in your practice. And if you are, if that acute remedy is a constant remedy of the patient, your patient would get from that seeing symptoms of psoriasis and your remedy works and the patient is cured. I've seen this in my practice. That's why I'm telling you. Now, this remedy chrysobium. Now, if you have read this remedy, acid chryso, it's a very, very important remedy, powerful skin irritant. You name the disease and chrysobium has it. It's ringworm or it is psoriasis, it is herpes, it is acne, all lesions having a foul smelling discharge and crust formation. A very, very important remedy for pustular type of psoriasis, where the psoriasis is super infected, there is a superadded infection, there's a lot of pus coming out. In that case, chrysobium works wonderfully. If you see the last line, chrysobium contains chrysofen, which is rapidly oxidized into chrysovic acid. So we have the remedy called as acid chryso. Itholium. Of course, this remedy also, if I don't say, the psoriasis would be incomplete. The remedy has been employed in disease of the throat and in the winter cough of aged. Also in tuberculosis and disease of skin and mucous membrane. See the last line, see the first line of the second para. It has an extensive use of local application in eczema, psoriasis, acne rosacea, erysipelas. In these cases, it should be prepared in the form of an ointment with lanolin 20 to 40%. This is, now see, we can keep on going on with Mater Medica. I think Nitromas is there that you can take care of. These are the remedies which I wanted to show. And oleander. Oleander, if you have seen the plant, see it first. It is a very interesting remedy. There's a scruffy pimples and slightest friction causes soreness and chapping. Friction. No, your friction and psoriasis increases. If these type of complaints are there, because the skin is so sensitive, it can cause oozing and there's a lot of dryness. If you have seen my slide, the cause of psoriasis was also a dry skin, that is oleander. Bleeding, oozing, want of perspiration, the skin is very dry, very sensitive, and soreness. Okay, so it is already 10 o'clock. Sorry, I've overshot Of course, there's one remedy called X-ray also. I think there are a lot of remedies in it. So we'll stop here, and if you have some questions, you can ask. I hope I was able to make you realize and give something more about psoriasis in this 1.5 hour presentation. And I hope it does make a difference in your practice. Okay. Over to you, Dr. Avansi.
Yes, sir. So, sir, Dr. Indraneel has asked that explain observation of abusive and dictatorial. Could not understand it from the presentation.
That's what I was telling one thing, the whole history when you hear the patient in front of you, the patient is not going to tell you I'm very abusive and this, but it is an observatory symptom. That's why I've written few lines, in that if the patient gets anger very easily, keeps on asking one thing, if you're going to treat me, then give me a medicine, otherwise don't give me the medicine. Those are dictatorial types. She was a bad loser. She was only playing for winning. She was playing carom. And that's why she does not go where she does not win. She only plays with person outside the house where she can win, because she's dictatorial personality. That's a difference. Yeah. Anything else?
So, doctor is also asking for the shading of slide of entry point in case, which is written in italics. So,
yeah. So I have to again go on the whole slide, So that's why I would say all homeopaths have to be a very keen observer. The answer was in front of you, but could not get it. That's the case taking we want. The remedy is in front of you, but you can't get the remedy. It happens, It happens to me most of the time, but now I have been a bit alert because I have 30 years of practice now. So that's why I put that italics. But whenever I'm teaching in my seminars and also I do this various things so the people know that something is there in that. So don't mind, you can have the presentation and entry points. I took only the dominance part and ungrateful part first, and then when we repertorized the case, everything was falling with Lacobodium. It was so close like that. Yeah. But
Yes, sir.
before
Another
we complete,
question.
yeah, please.
Biswa Ranjan has asked, what are the indications of X-ray in psoriasis?
Okay, so see, remedies, you have see, remember one thing in exam psoriasis. First of all, a very nice question, because if you have seen my presentation, I've written radiations and EMFs. So you have caught me very well. The answer is that only. In today's world, now if somebody has pain in the abdomen, we don't say go and do the sonography. We say do a CT scan or MRI scan. You know, so there are so many scans, so many contrast that can also have some effect on your body. And the first thing, X-ray. If you want to see X-ray, the nails of the patient are thickened. First symptom of X-ray. It happens in psoriasis, and there are painful. The cracks of psoriasis in X-ray are very painful, and the skin in X-ray is dry and wrinkled skin. That are the 3 and 4 most important indication of X-ray I have seen in my practice in psoriasis. Yeah, can we go further?
Yes, sir.
So
Next,
before I think,
Aniket Singh has asked, once explain the posology of the skin case.
yeah, in the see normally whatever I do in my practice, when I start the case of a psychosyphilitic case or a syphilitic case, I start with 200 potency. Then according to the patient's reaction, I'll give 200 potency one more time. And then, as Dr. Kentes said, that after 2 repetitions, you have to shift to the other potency. I'll go to 1M. And if, now remember this word, if it does not work or does not work according to what I want, I don't repeat like out of 1M. Then I go to LM potency. I directly go to LM 0/7. Repetition, sometimes once a day, every day for 1 week. And then when I find it is working, then I alternate days, once in 3 days, and then once a week, and then taper it off. Then again, if the symptoms come, I maybe go to LM8, LM9, LM10, depending on the susceptibility and the reaction of the patient to the medicine and the prognosis of the disease.
Next, Kanishkar Sankar has asked, can you share about repetition and potency of the remedy that you have prescribed commonly in psoriasis cases?
Just
That's
that's what I told you.
the same
I
question.
went 200 potency, repeat it once, then I go to 1M potency, then LM potency.
Okay, so that's all from for now.
Just one thing I'll just add, that very thankful to Homeopathy 360. Wonderful platform. I just saw my messages you saw on the screen of your Instagram page, lot of good lecturers. And see, homeopathy will only grow if such type of platforms are given to doctors.
Yes, sir.
Very nice work, a very neutral platform, and you're doing a great job. And I hope everybody joins 360 so that everybody gains something. All lectures
Yes, sir.
basically will help you to grow in homeopathy. There's no
Yes, sir.
competition of who is good and who is bad. Everybody is curing cases.
Exactly.
Everybody is curing cases. But how they are curing, and so there are so many approaches. Every approach has some pros and some cons, maybe. But if you provide a platform, a neutral platform, no, everybody goes. So first of all, a big thank you to Homeopathy 360 and the Heritage Magazine also. Thank
Thank
you
you
so
so
much.
much, sir. Thank you so much. And we had a great time with you. Today we have learned a lot of things, and personally, I really liked your lecture. The case presentation was really nice, and the session was full of knowledge. It was really very informative.
Thank you.
Today, we have witnessed the miracles of homeopathy, which is really very good. So, sir, thank you so much. We are very thankful.
Thank you, Dr. Mansi. Thank you so much. Any feedback is that you can always call me or always hit me on the.
Okay, sir. Thank you for giving
Thank
your
you.
such precious time.
Thank you, Dr. Mansi. Thank you.
Thank you.